All right. Well, folks, I have an absolute treat for you today because these two women I actually got to meet like in person at the Feeding Matters conference, which was amazing. So please sign up for the next one next February in Phoenix, Arizona. And I met covered in salty, grimy winter clothes because I boarded a plane, and I get off the plane and y'all are already in like summer breezy Arizona clothes. We're all checking into our hotels. And by the end of the trip, we were all on a rooftop. There was many adult beverages and dancing it out and shouting it out to AC/DC Back in Black. Or no, She Shook Me All Night Long. It was She Shook Me All Night Long. Yes. So like, one, they are brilliant at what they do. And two, God, we're fun. So that this is what happens. They say go to a professional conference to learn, but also find your tribe and meet your people. So, God, thank you so much. So I have Dawn and I have Jen, and these two brilliant, compassionate, petite powerhouses actually led the initiative to put pediatric feeding and swallowing disorders in the public schools. And so their presentation at Feeding Matters was the systematic implementation of how they did this over the course of an entire academic year. And the meticulous and hopeful nature that y'all presented with, like down to this is the nitty gritty, but you left the audience feeling like, oh, but we can actually do this, is a rare find. So with a full heart, thank you. But introduce yourselves. Tell us all the things. Hi.
Hi. All right, well, I'll go first. I'm Jen Eggert. How much do you want me to tell them? I am currently currently a clinical assistant professor at Marquette University in Milwaukee, Wisconsin, where I supervise on-campus clinicals, and I also take kids off campus to a place, if some of you are familiar with Gigi's Playhouse, which works with kids with Down syndrome and other developmental delays. And then I also teach some classes for them. I also just got a grant for them, which is super exciting. I won a grant where it's called the Explorer Challenge, which is to explore new initiatives. And we are starting an interdisciplinary diagnostic feeding team and treatment team, which is super exciting.
Amazing.
I also, in my free time, love to still work clinically, which is why I'm dressed like this. I don't know if they can see my shirt.
Oh, yeah. Yes. Y'all,
Yeah,
her shirt says try my best.
Yes, it says try my best. And so I also work for a clinic here called Tender Touch Medical Support Services. And we co-sponsor a triathlon for individuals with special needs every year. And so this weekend is the triathlon. And so we are all running around like crazy, like literally loading like every bike and every piece of special equipment that we own into like moving vans. And it's crazy. Like we do it's a true triathlon. We do a swim, a bike, and a run, and there are hundreds of volunteers because everything is adapted. Every aspect of it is adapted. Like we are changing bikes, and like there's like PTs on scooters like going backwards like through the whole course to like support kids with different physical needs. So that's why I look like this. So for those of you who can't see me, there's no makeup and the hair is fuzzy, but we don't care.
No, I love this. This is authentic speech pathologist in the wild. And yeah. I mean, we popped on, and as usual, folks, I'm late, but that's because we had to do our wills this morning. And I was trying not to have a panic attack to go from planning estate planning, because that sucks, to like something joyful, like PFD in the schools for the entire state. And I was like, I have to take a shower because I'm having that, that sweat that you get right before you have a full blown meltdown. It was like the armpit, like squirt sweat. Yes. Yeah. At least that's how my anxiety manifests. So TMI, but if you too have anxiety and panic attacks, you know what I'm talking about. So one shower later, hi, Dawn, on that awkward note, how are you doing, beautiful?
Well, thanks for having us here today, Michelle. This is really special to be invited to be part of your podcast. So I'm a speech language pathologist as well. I have worked most of my career in the school setting, even though when I initially got into this field, I was never going to work in schools. I got started and got hooked. So I, for the last 3 years, have had the opportunity to work for the Wisconsin Department of Public Instruction. So working at the state level has been a little bit different. And while I miss working with students, I get the opportunity to now support speech language pathologists across the state with speech and language and assistive technology. So that's been a real treat and a really nice career change. So, and Michelle and I actually crossed paths years ago as we were both state association presidents, but it's been so fun to reconnect. Yes. It's been
This
great
is
to
like a
reconnect
meeting of former
now in a
state
different.
association presidents, because we were all former state association presidents.
That's true, yeah.
So, folks, join your state association, volunteer, because it is a volunteer task, but legit, CSAP is amazing. The Council of State Association Presidents is where they train speech pathologists on like leadership development skills and then how to work with ASHA for policy improvement, policy implementation. If you have issues with lobbyists or with management companies, they give you all of the insight because that's not something that's covered. We come out of grad school and we think all these speech therapy things magically happen, but it's not. It's volunteer work and then us tithe of time and talents and policy development. If you're working for the state, that's the opportunity, especially if you've had the lived experience of being a speech pathologist in the public schools. When you get to the opportunity to do the process improvement, you can say, oh yeah, no, that's not really what it's going to look like in the real world. Which, let's be honest, I think our leaders need more of that experience, and that's all I'm going to say and drink my tea. So on that, yeah, change topics, Michelle. Okay, but y'all pitched and did this project presentation on PFD in the schools. So, Dawn, were you doing it in the schools before you went into leadership?
I was, but when I talked to both of my predecessors in this position before me, I said, well, I don't see where feeding and swallowing is part of our criteria for speech or language impairment, even though it's part of our scope of practice. So how does that fit in, and who treats that in the schools? And I was just always told the person with the most experience on the team should treat it. And I just felt like it really needed to be a team process. Like that made sense to me. Okay, I know what to do. I can go ahead. But I always tried to work with other people on the team and really make it a team process. And that's what you'll see is kind of a theme through what we've done now with our guidance in developing that in Wisconsin.
So how do y'all know each other?
Through our state association.
Yes, through our state association. So we're both past WSHA, Wisconsin Speech Language Hearing Association presidents, and we got to know each other that way and just have professionally, just kept in touch through the years. We get together every year at the annual convention, and one time we were just chit-chatting about pediatric feeding and swallowing, and Jen says, I have some ideas. So
famous last words.
We connected, yes.
Yeah. Okay, so what was, big picture, what was the timeline from I have some ideas to y'all presenting in Phoenix in February?
So, it's funny because when we were talking before we started hitting record, I had like think about like what has been your journey as a speech pathologist, right? Like how did you get into this field and everything? And so like and I will get to your question through this story, is that my journey has been like when I was in grad school, I was not a troublemaker, except that I was like a very good advocate for myself. And myself and another one of my colleagues, now still, we were in grad school and we were like, we don't want to do an adult medical placement. We know we want to work in pediatrics. We know we have an interest in this area. And I mean, and this was in the 90s. So like birth to 3 and all of this was still like evolving, right? And we got in a little bit of trouble. So like the department chair was not happy with us that we were advocating for something outside of the norm, which was you did a pediatric school placement and you did an adult medical placement, right?
Why?
Right. Why? So like I've always had this feeling of like I need to advocate for my own learning so that I can advocate for my patients. So I did advocate for myself, and I got put in a birth to 3 setting with some different supervisors, and got that birth to 3 experience, right? And then I did, instead of doing like a typical adult placement, I did a placement with adults who had very, very significant needs, like the adults, what we used to call the adult DD population. And most of these individuals were actually living at a place where I was, like the wards of the state. I mean, these were different times. This was a place called Southern Wisconsin Center that's no longer in existence. So I come out with all of this experience, and like working with these adults was just like working with some of the kids that I worked with, and
Yes.
the same goals, right? And everything had to be very functional and like work within their setting. So then I go out into the real world, and I am working in birth to 3. I'm working in outpatient. I worked for 7 years in pediatric home health, where I was in some of the most amazing homes. But I'll be honest, like I was in some of the most marginalized communities in Milwaukee. For those of you who are listening and don't know, Milwaukee is one of the most segregated cities in the United States. Hear that again. Milwaukee
Coming
is
from South Carolina, that's like blowing my mind.
Yes, Milwaukee is one of the top 3 most segregated cities in the United States. When
Wow.
you drive around the city of Milwaukee, you are very clearly in a Latino population. You are very clearly, which is actually a physical barrier, the freeway. You are very clearly in a Black/African American community. And then you are very clearly in all of the other suburban where all of the European individuals settled.
Red
So
line.
it's mind-blowing. But I was blessed enough to be in these communities, to be in these homes, to be welcomed by these families, and to feel safe and to learn from them. And one of the things, again, that I learned from them was that they don't know how to advocate. They've always been, a lot of these people are stuck in systems, different systems.
Yes.
There's so many systems that they're stuck in, right? And so and then I worked for 10 years in a pediatric skilled nursing facility, one of the only pediatric skilled nursing facilities in the US that was also tied to a school, a public charter school for kids with special needs. And we had a private charter for kids with special needs. So like my toes were sort of in the schools, or I was transitioning kids to the schools.
Yeah.
And so while, I've spent very little time in what you would think of as a traditional school, between working with the families that I've worked with, working with the populations that I've worked with, because I've always worked with very medically involved kids, and pediatric hospice and palliative. So I've worked with some very, very delicate, very critical populations. I have learned that you always have to think about what you're advocating for them now, but also in the future. Like
Yes.
you always have to be thinking ahead.
The Christians, okay, go back to will planning, looking at it from Uncle Matthew's perspective, what he went through as a child, and now he's a grown man. We're 48, but cognitively 7. So like doing the trust and setting all that up, but watching him, his dysphagia starting to emerge. We're starting to get some oral stage dysphagia. We're starting to have some tonal changes, some acid reflux. And it's, I know there's dysphagia coming with age, but also we have CP, we have autism, we have a cortical vision impairment. So it's the same but different. And it strikes me as it brings home more and more what I do on the tiny human world to set for success, and to also plant the seed now for some of these kids. We're going to age different. It's going to look different. You need to be prepared. Different isn't bad. It's just different. Yes.
And it's always been, I'm going to use a really strong word. It's always been unconscionable to me, truly unconscionable to me, that nobody pays attention to feeding in the schools. Now, I don't know about you, but I can't go more than 2 hours without a snack.
I'm sorry.
This has nothing to do with the fact that I have acid reflux. And this has truly nothing to do with the fact that I'm perimenopausal. I need
Oh God, we need an episode of perimenopause and how to tie that into the world of speech therapy. I haven't found the connection yet, but if we dig, we'll find.
Hey, I have ideas. No, I'm just kidding. No. So I've always thought to myself, why is it considered that you can learn how to walk up the steps to be successful to access your education? Why has it been considered important to be able to open doors or whatever OT and PT works on to be successful in your academic environment? But why is nobody saying you need to eat to be successful in your academic environment? Because we know that nutrition is directly tied to
Academic performance.
to academic performance, right? In so many ways, not only just through academic performance, but through your alertness level and blood sugar levels and all of that. And also, again, we have kids, a significant number of kids, which are very at risk in today's population, in today's environment. Let's say this, in today's political environment, who get a majority of their nutrition
From
through the
school.
public schools.
Yes.
They get breakfast, snack, lunch, snack. And nobody's paying attention to this and just assuming that everybody's successful. It's unconscionable to me.
Yes. Okay, well, wait, Dawn, how did you start doing feeding in the schools when, I mean, it's an anomaly. It truly is an anomaly to have it is a luxury to have had the opportunity afforded to you that you could do it. But how did that happen for you?
Well, I was in two very rural school districts. So we didn't have a lot, around us, quite different from Milwaukee area. And I would say, I think for me, coming from starting my career in skilled nursing, I had already advocated for the patients that I was working with there, and
Yeah.
actually in a rural area I had gotten hospital privileges to be part of or do my own swallow studies for my patients. Yeah. So
Yes.
I came in and I felt like I had that experience, although not with children, not with pediatrics. And I know it's different, but at least I had some background where I
Yeah.
feel like a lot of people going into schools, if you've been there a while, you may have never even had a dysphagia course in your graduate training, or you may have had the one course but not had the experience. And so I felt that it was really important and advocated for me to be a part of that with the students that I saw. And we looked at what were their needs versus what category did they fall under as far as a disability category.
Yes. There's something, not sure if you can hear in the background. Waffles is having a bad dream. So if you hear the dog in the background, it's terrible. But there's something to be said about a rural community. So I started out as a speech therapy assistant in the public schools in a rural community, then went hospital, went to South Carolina, couldn't find an inpatient job because I didn't go to one of the two universities in South Carolina. I was a come here and biasy, but it is what it is. And it's gotten better now. And got into early intervention, but I didn't want to work with children again. So it's neat to see. You said something earlier about where you land or where you're placed. And I was like, that's the good Lord putting you right where he wants you. And that's how it happened. But a rural community sometimes has less red tape, and I have found that they see the whole child or their colleagues and the gifts that they're bringing. And I don't have any scientific evidence to support this, but I think it's just that there's time and grace because it's less rushed, which sucks. But I also think our society is rushed in general. But I mean, those are all opinions and not facts. And we have plenty of those. But okay, so you guys are coming with these pockets of skills, get together. I'm assuming at a Wisha, say, I have a vision. And then what happened?
So, Jen, I can't remember if I was actually in my current job at that time. I may have just started, or it may have even been before I was in my current job. But one thing that I did then is at the state level, tried to pull together education consultants from the different areas that I felt needed to be part of this team and putting together this guidance.
Wait, when you say education consultant, what does that position look like? Because that's different in every state.
Okay, so that's the role that I have at the state level. I'm considered an education consultant
Okay.
supporting speech language and assistive technology.
Okay.
So I worked with the consultant for OT and PT, the consultant
Okay,
for
cool.
nursing, the consultant for dietary or nutrition needs. And we pulled all those people together. We pulled in Jen and also Amy Delaney from Marquette.
Amy,
And
we love you.
yes, then we pulled in also some outside consultants, or actually outside SLPs working in the field too, to help us out too, because we were working on developing guidance for speech language pathologists, but we knew it had to be a whole team effort and guidance for
Yeah.
the whole district. So
Yeah.
And then we were on this group together and we started like, it was so like authentic and organic in that we just started pulling together resources. Like it was so much fun to see like who knew what and who knew what they didn't know. And
Yes.
like there was one point where like somebody threw out a name and we were like, that person is great at what they do, but that's not specific to this, you know. And then like, or like we'd pull in like some resources. Like there were people who didn't know when we started this 3 years ago now, all of the things that Feeding Matters has out there. And so
Yes.
they were like learning too. And so it was just fabulous to like see how authentically and organically this grew. And it was like this little Google Doc that like grew and grew and grew and grew and grew. And then we have to give another shout out to Amy, because Amy and I were kind of the two speech therapists on this, along with some other speech therapists in the area. And Dawn was like, we need to turn this into a webinar series. She had
Yeah.
this vision of turning this into a webinar series. And we had all agreed to work backwards. And by working backwards, I mean we were going to do the webinar series, crowdsource information from participants to say, what do you know? What do you need to know? And then write the guidance book. And so,
So
yeah,
cool.
so we
So
decided, so
cool.
Dawn had this brainchild of doing this. And again, I want to give a shout out to my friend and colleague, Amy Delaney, because her and I were talking and I was like, who wants to do this, Amy, you or I? And I was like, I honestly feel like I have the time. I was like, but I feel like you're Dr. Amy Delaney. Like you helped write the framework for PFD. Like she's amazing. Like I adore her. And it was such a moment of it was such an uplifting moment when she was like, Jen, there's no reason why you can't do this.
I can
And
hear her saying that. And I can even see her little hands, like the way
yes,
she,
like
yes, yes.
no reason why you can't do this. And that's why Amy and I work so well together, is because I have different clinical insight, where she has different research insight, and we come together like so well, where she'd be like, okay, how could you see this implemented in the real world, you know? And so it's just, so it's beautiful. So I want to give props to her, because I feel like it was a gift to be able to have her say, yes, you can do this, and you know this.
well, and I think it's a good time to give a shout out to other pioneers in our field. I mean, every year when I would attend the ASHA convention, I would try to find something related to pediatric feeding and swallowing in schools. And it wasn't always easy to find, but I had attended sessions by Emily Homer and all of the work that she's done to try to get this going on a national level. And I remember an ethics session with Lisa Powerdefer and Emily Homer about feeding and swallowing in schools, and just that really got me going. And then in my position, I have the fortunate opportunity to be part of the SEA CDC, which is the State Education Agency's Communication Disability Council. Big mouthful.
Yeah.
But what it is people in my position from across the country that get together. And because of that, I found out that the state of Arkansas and the wonderful work that they were doing there with Emily Homer was really something similar to what we wanted to do in Wisconsin. So we really modeled our work after what they've done in the state of Arkansas and what Emily had done prior to that.
Yes. Well, we years and years and years ago, Angie Thompson Neal set it up, led it in South Carolina when she came on. She set up the guidance in South Carolina, but because of all complications in South Carolina politics, it took forever to be adapted, but there was no there was no training. So there's a policy for it,
Mhm.
but because there's so few programs that put feeding and swallowing within the curriculum, U of SC has a class that's elective and MUSC has training, but there's like 3, 4, 5 other programs and there's not an explicit like additional course for it. There's a dire need. Well, my twin came out. A definitive need for hands-on training to even create the practitioners to do it. But that's what. So when I saw it, I was because I volunteered and helped do my part for the companion guide for South Carolina. I was like, we only scratched the surface. We created the policy, but there was no implementation. Which yes, but like, how do you do it better? And that's what was, and I love seeing my faults or my shortcomings because that's how I grow as a human, right?
Mhm.
And so to see what y'all did with the systematic trainings, I was like, that's what's missing. And now that I'm here in Virginia, it's a Commonwealth, which is totally freaking confusing because everything does it different than an actual state. I would love to see over the next couple of years y'all's outcome and growth to try to recreate that here in Virginia because there's now we have room for it again. So y'all spoke this into the universe and then you had your team meetings with all of your interprofessional practice partners, which is spectacular. How did y'all go from meetings and paper to application?
Well, I want Dawn to answer that question, but can I just talk for 1 second about the fact that I think the biggest piece of what we did, it wasn't just the trainings. It isn't going to be just the guidance book. It is the piece of us acknowledging when you said your shortcomings, of us acknowledging that speech language pathologists in the schools have a very unique skill set, like we all
Yes.
do, right? But
Yes.
they also, when you think about the big nine, right? When you think about the big nine area that we treat, they treat a lot of them. And they are so it is so important for them to keep up with so many different areas. When you think
Yes.
about speech sound disorders,
Yes.
artic and phonology, and CAS, and then you think about, okay, now they've got to also be experts in fluency in case that one fluency case comes up, and then they also, and all of the social language pieces, and now everything that we do with speech generating devices, like their brains are very full.
Yes.
And so I think the biggest piece and a lot of the feedback that we got was that we recognized and acknowledged that they did not have the tools, the
Yes.
resources, or the capacity to become a specialist in something else.
Yes. And
And
that's,
so
go ahead. Yeah.
and so instead, we said, we want you to partner with outpatient providers, medical
Yes.
providers, whoever, and to say, let's do this in an ethical manner. Let's do this instead by saying you are responsible for implementation. You're responsible for carryover. And I think that made a huge difference for us.
Yes.
Yes.
It,
But
it,
Dawn,
it,
answer her question.
yes.
Well, I think that was a really good point in that, we said right from the start, we're not here to make you all experts in pediatric, feeding and swallowing. We're here to help you find those partnerships and provide the training and the guidance to help children participate in eating at school and,
And be
especially what's
successful.
impacting them educationally. Right.
Yeah.
Functional participation. Functional participation.
Right. Right.
Yes.
Yes.
That's
Yeah.
that was the pitch that Angie made in South Carolina was that like you could have the recommendation given was have the one person do it for the county, do it for the division, and then assist with carryover. And that was how we, but like still equipping that one person with like the design of how you put this on a team, how you put this on paper. And then so folks, if you're listening and you would like additional, say your place of employment requires additional guidance, Memory Goes about 2 years ago led the update for the Journal for Speech Language Hearing in the Public Schools. for feeding and swallowing in the public schools because the last iteration had been 14 years ago. And so they put in paper all of the journals for the research why, for the how to do why. So that's a great resource if your director of SPED or your superintendent wants additional written documentation. There's that, because it's published within ASHA and because it's published within the journal, it gives it, like, for lack of a better phrase, street cred. And you can access all of that for free through your ASHA membership. So just as a gentle reminder there too. But yeah.
And just as a heads up too, another shout out to Feeding Matters. I'm working on the advocacy pillar because we all need one more thing to volunteer with. And,
Yep.
I look at it as earning my place in speech therapy heaven. And in case any of you are wondering, I am quite certain that in speech therapy heaven, there is no documentation and there are no emails to answer.
And bubble machines. Please tell me there's bubble machines that don't require batteries to be rotated.
Pop bubbles and float around on fluffy clouds for the rest of my life.
Yeah.
I'll be happy. Somebody needs to blow bubbles for me for a change.
Yes.
But we are working on, and we're launching it like within the next couple of weeks. So probably about the same time as this podcast is going to be aired, we are launching a toolkit that parents and caregivers can use for the schools.
Yes.
And it's very specific little forms, easy to use. It's a how-to sheet. It's with QR codes and a simple sheet to fill out. And so we're going to be launching that. So that's a great place to start too, because what our intention with that is to give the power to the caregivers and to say, I have this information and this resource is going to help me to efficiently and effectively be an advocate for my child. And it will give you everything that you need to get that started in the schools.
Okay.
I think that's an important point too, in that, just like it doesn't have to go to the person who has the most experience on the team. It needs to really be a team approach. And that was something that, we really tried to do too, in bringing in our school nurse consultant and our dietary nutrition consultant, and making sure that it was a team thing. I mean, so many things, like you were saying, Jen, we have to know so many things when we work in the schools. And just to have that where we don't have to be the expert on everything, we can work as a team together, I think is really important.
Yeah. I met with a different state association because they picked my brain. And one of the representatives from the state association was so angry at me for suggesting feeding in the schools. And it was fear. And I recognized it for what it was. And I was like, at the end of the day, I was like, yeah, it's one more thing. I was like, but you can devise a plan to work together. I was like, but these kids are still there and they're still coming, and we're saving babies with more and more complex cases, like total, if you're looking at like all of the etiologies and comorbidities, and they have a right to public school. They have a right to be with their typically developing peers. That we're going to have to do something. And it, honestly, the meeting ended, the representative was still visibly angry at me. And I was like, y'all called me. I was just there to be like, these are some ideas, consider this. And afterwards, one of the colleagues that tossed my name in the room, she was like, I'm so sorry. She goes, we had no idea that it would go that way. And I was like, it's okay. I was like, but we have to acknowledge the fear and the uncomfortable. But it's what you do with that next breath that you step out of the fear, because the fear is where you grow, right? Like, I don't want to write a freaking will. Ugh. But like, you have to do these things, Michelle Linwood Dawson, and you grow with the fear. So pep talk for self. Okay.
And
so
what your mind goes right to, okay, now I have to be there at every meal and I have to do this and this and this. And that's why Jen and I really talked about that carryover and implementation. You don't have to be the person that's there at every meal. You can train someone who's there at every meal and helps take that data and, follow through with the recommendations.
And we're already doing this with AAC. We have models for this that are successful and they thrive. It's just the application to something that's, I don't know. I love feeding. It's so joyful. But I remember starting out and remember being afraid with every little cough, every little, watery eye. So, all right.
Well,
So,
and I think like administration, I think can also be a barrier that needs to be addressed because, I think about probably from an administration standpoint, like administrators who've been in the schools for a while have gone from, okay, we have a child with a mobility difference
mhm.
to now we have a child with we have children with medical equipment in the schools. Like think
Mhm.
about all of the, like you
Very
said,
expensive.
medically, right? Like trachs and vents and G tubes and, all of these things that kids are bringing to the schools. And so it's always like, it's another step, right? And they just need to become comfortable with this next thing. And I feel like for a lot of the schools, this is the next thing. But I mean, I'll tell you, I think feeding and swallowing is a lot less scary than having a trach or a vent in your school. And I worked in trach vent for 10 years. Like I love trachs and vents, but like to me, like feeding is way less scary than trachs and vents.
Our tick overwhelms me. Like
Yeah.
that should be the thing that I should be able to do as a speech therapist. And I get so anxious about doing Arctic or like speech sound disorders or the literacy side. No, bless those that can. I will graciously bow out and send them to the correct people. But somebody will say, well, you're doing feeding. Can't you work on this? And I'm like, no way. That is
Michelle,
not.
that sweat that
Yes,
you were describing? I get that when I get a kid with an R.
yes, Bear
I was
was
like,
an R,
oh,
and he couldn't say
no,
his
no,
name. You,
R's. I
yes,
don't do R's. I'll
no,
suction you. I'll suction you if you need to be suctioned. I can run a feed. I can start a pump.
nope,
I
no
can put
R's.
in I can put in an inline speaking valve, but I am not doing R's.
Okay, yes, exactly. All right, so Dawn, what did y'all do? What was the next step? We go from these meetings where we're pulling everybody in and we're brainstorming. What happened?
So I have a really supportive boss, and I went to him and I said, "This is what I want to do, and I want to contract with someone to do these webinars. I want to do a personal services contract, and here's how I want to do it. We want to do a webinar each month for the whole school year, and then we want to come up with a guidance document the following fall because we, as Jen said, wanted to pull all that information we gleaned from the webinars and the questions we received from our audience." And pull that all into the guidance. It wasn't an issue at all. We set up that contract with Jen and did all the scheduling. And right now we are currently working on getting that publication done for our guidance document. So we're hoping to have it by end of October, beginning of November.
Okay, amazing. But how did you decide the order and the topic of the webinars?
Mm-hmm. Well, we really looked at the model that the state of Arkansas had done the year before. And luckily, I had been able to attend those webinars for free, even being from another state. And, we really looked at what they had done. And then we followed their model, but tweaked ours just a little bit to fit more what we were trying to accomplish in Wisconsin and what our philosophy was.
And I feel like actually like I'm gonna give us a pat on the back. Like I feel like we tweaked it quite a bit. Like we really like we like changed the order, we changed the names of things, like we changed the information that was included. Again, because ours wasn't just geared towards speech pathologists and occupational therapists. I came into this not only shouting safe and functional participation, but also screaming, I want the whatever you call them in your school, the paraprofessionals, the aides, the assistants, I want them there. I
Yes.
need them to be here understanding because they're the piece that is vital to carry over. And so we really broke it down too, as far as saying like, who needs to be here and what is applicable to who. Like you were welcome, everyone was welcome to every webinar series, which was held, pretty much the same time of the week of each month, the same day, like to make it succinct. And then Dawn, of course, has the amazing technology support on her side to record it and then just put it out there for everybody, to be able to access because we're all busy, right?
Yeah.
but my piece, I think really we really did say like, this is, we were being inclusive. Like we were saying, next time you come, bring an administrator. We would
Yes.
say the next time you come, bring a paraprofessional with you. Tell your school nurse about this. Like tell your dietary nutrition people about this. And we just kept trying to say like, it's as a colleague, Dawn and I often says, it's about the ask, right? It's about the ask. Like if you get that personal ask, then you're like, oh, I'm invited to the table. I'm invited to this.
Yes.
And so I feel like not that other programs haven't been as inclusive, but I'm just saying like our approach was different in that, we really were trying to not say like, okay, well, here's what you do. It was, no, we want you to be a part of this and the training and the learning
Coming
and giving
together.
us feedback. Right,
Yes.
right.
So in my mind's eye, I would want to make sure people had an understanding of like what pediatric feeding disorder is, what dysphagia is, and then go from like, and this is, so tell me where I'm wrong. I would start with like describing it, understanding it. This is what assessment looks like. This is what treatment looks like. This is what safety protocols look like. How did y'all set up the webinars? And how much time did you give for Q&A? Because good Lord, I'd be the person in the audience with like 4 billion questions that everybody tells to shush. But I was also the grad student. So
Dawn, do you have the list in front of you? Do you have the list?
I have the list in front of me. Yeah.
Yeah.
So I started out, as you said, Michelle, with that overview of what is pediatric feeding disorder, and what do people need to know about it? Just kind of just that overview. And then we went into the next month into legal and ethical considerations. So, what do we have for laws and regulations, prior court cases, things like that, that's saying that it's not okay to just say we don't do feeding and swallowing in schools. We need
it's not. It's illegal to say we don't do
Right.
feeding and swallowing in schools.
We wanted
And
to
we
get
really
that
moved
out of
into
the way
what
right
is
away.
a team approach. Who should be on your team? How do you gather those people together and work on that even before you have a student that with those needs in your district?
Yes.
Then we moved into assessment. So very similar to what you were saying, Michelle. Just procedures for assessment, what that might look like, knowing that each state is a little bit different. And so there again is where we differed from Arkansas, because they could do an observation or an interview before they started that comprehensive special education evaluation process. We can't do that in Wisconsin. So we have to have that be part of our evaluation or assessment process. So, how does that work in our state? What does assessment look like? That we talked about some best practice considerations, and then moved into that, how do we implement it and how do we train those who will be carrying over our programs. We talked about some common barriers and concerns. And at the end of the year, we did some case studies. So we actually had some districts that sent in cases, de-identified information, and we used those cases to do breakout rooms during that session and brainstorm, just all of the things that they could think of that would help in that case, and what questions they had, further questions, because I think that's going to help us too with developing more of our Q&A. And then at the end of the year, we just did a final, here's our year in review. This is where we started, where we are now. And then it was an open forum where people could ask questions and talk about some of the cases.
So then my next question is, I'm going to show up to something that is intriguing, but getting CEUs for it is always like a bonus, or getting professional development hours. Did y'all have to get that through or have it count towards, like, I remember some states require professional development hours for SLPs if they work in the public schools through their Department of Ed. So did y'all offer that for attendees? And did you notice that, like, I have questions about the data, about the attendees themselves. Like, did you track who came and those kind of things?
Yeah. So as far as CEUs, we are not an ASHA CEU provider at the state level. And because we had different professionals that were also joining, we had OTs, PTs, nurses.
Yeah.
What we offered was a certificate of participation. that
Okay.
participants could download, use for their district if they had to get so many hours in their
Yep.
district, or they could use it if they track their own, like say ASHA professional development hours. So we did offer that certificate, but we did talk about that. You know, people always want to get the CEUs. It's
Yeah.
just at state level, we're not a provider of CEUs. And then as far as like attendees, I have some general information like I can share with
Yeah.
you, so that we had nearly 400 registrants. Most of them were OTs, PTs, or most were OTs and SLPs, and most had 10 plus years experience, which is really interesting.
Oh, I love that.
Yes, yeah. And so live attendees, what we were, you know, we have a record of how many attended live, but we also found out that teams were taking the recording, and the next time they had their team meeting, they were viewing it together as a team. So they didn't always attend live, they took the recording and viewed it later, which we thought that was really unique and really good that they could talk about their questions and, you know,
Yeah.
view it as a group. Let's see, 62% at the start of the series said they had no prior training in pediatric feeding disorder. And 100% that attended or filled out the survey said that they did not have a team already established in their districts. So,
Wow.
one of the exciting things we found out is 2 or 3 districts that have contacted us since, you know, have said, well, we started a team, here's our questions, or, you know, so yeah,
Yes.
we're so excited.
Yes.
Yeah. A lot of them had real limited, they felt like their knowledge was limited. So when we had them rate their knowledge, almost 60% put themselves at a 1 or a 2 on a scale to 5 of what their knowledge was when they started. And just halfway through, 33% felt that they'd already increased their confidence, which we thought was really cool. And at the end of the series, 74% said they put themselves at a 4 or 5.
That's awesome.
So just from doing that 9-month series. And I think doing it throughout the year was a little less overwhelming than just taking a, you know, 2 or 3 hour
Yay.
course, you know,
Yes.
that they could spread the training out throughout the year. So that's
I think
some of the statistics we have, but go ahead, Jen.
Well, I think what's been really nice too is as I've been out like in the world, in the community, like people will come
In the
up to me.
wild.
Yeah, in the outside of the cute little room I'm in here with the mountain wall behind me. I'm in the mountain wall at the clinic I'm at today. I think it's been fun to have people come up to me and be like, "Oh my gosh, I keep forgetting to tell you." And it's always followed by, "I was looking up some stuff on feeding and swallowing in the schools and I came upon your webinar series." And I'm like,
Yes.
"That's awesome." And I think, I think the other thing that's been really fun to see is that like people are excited for this guidance book to come out. They're like, okay, now how do I take this and like really run with it? How do I have it like in hand? Because I've had people saying that to me. And, we gave them resources of things like, people are like, well, now, okay, you're telling me I should be doing the carryover, but you're telling me I should do the assessment. Well, we gave them tools that are validated, like everything
Yes.
from Matters, things from Feeding Flock, that were
Yes.
like, these questions you need to ask, it scores it for you. This is where you need to go. So I think they just feel very supported.
Yes. So I redid my syllabus for the PFD class that I teach for North Carolina Central University, and pulled in PROMs, psychosocial measurement, and had the students practice giving the PROMs from Feeding Flock to another as if they were the caregivers. And especially with the insurance changes, which I'll hold that because I had a question about billing for you guys, but with the being able to chart the psychosocial domain of PFD, because for caregivers, that psychosocial domain tends to be so profound, right? And this is connected, but our Bible study this morning was all about building your house on rocks versus sand, and how if you build a firm foundation, then you're going to weather it, right? And having a tool, a quick tool that's validated to be asking the caregiver at the start of services and at the end, how do you feel? How does your child feel during their feeding? Shows growth when, especially for some of these children, the end goal might not be adding 10 foods. It could be taking the food in safer and improving quality of life, that functional piece, and having that resource at hand and readily available, and it's normed. I don't know. It was awesome to see the students this semester find it and grow in it, because now they're going to take it out to be SLPs in the wild. But it was just, yeah, firm foundations. Yeah.
So you had a question about insurance, Dawn.
Oh, bloody hell, yes, I did. ADHD brain. Okay, so back to the billing, because that was, I got all emotional and was thinking about Bear's insight into a rock foundation versus sand and mom moment.
We all are here to support each other.
Yes, rein it in, Shell.
Yeah.
But we're using that as a tool to show growth because of the Medicaid changes that are coming down the pipeline, being able to show growth for those individuals that have slow incremental changes because of their baseline disabilities. But that's a response for Medicaid. Are y'all billing for feeding in the schools in Wisconsin? I mean, is this covered under IEP? Because I know different states bill for speech therapy services. And if so, how are y'all doing it? Or is that not an issue there?
I would say if the speech language pathologists, usually it would be the SLPs, OTs, PTs, nurses who are billing for their services, billing Medicaid in the schools, and it wouldn't be any different than billing for anything else. So you're working towards the goals on the IEP, and you have that time written under the IEP. You bill for the time that you see the child face to face. So.
Okay. I know some states aren't billing for services. So it just kind of, it depends. But folks, if you are, make sure you're using the correct CPT codes, because 92507 is for language and 92526 is for feeding and swallowing. You can't use the language for feeding and swallowing. So that's.
And can we talk about diagnostic codes too? Because
Yeah.
Dawn, do you need the diagnostic codes to bill? And I think a big conversation that to this day I'm still having with clinicians is now we can say like back in the day, which was only like 5 years ago or whatever. But like back in the day, everybody either had oral dysphagia, oral pharyngeal dysphagia, right? Like those were the codes we were stuck with. And now, if you don't know, what is it? R63.3, right? Now, is that the right code?
3-2. So yes. So
3-2.
we used to have to do like oral dysphagia, which is like R1311, or oropharyngeal CPT code R1312. But now you don't have to have just a dysphagia. You can have chronic pediatric feeding disorder, which is R63.32. But the catch is, what I consistently see pediatricians write is R63.33, which is feeding difficulties. That isn't what we're treating. So, and what is interesting is it's within the scope of practice of a speech language pathologist, because that's why we have the ologist on the end of our name. We can correct if the script is incorrect. And in order to bill services, you kind of do need to have a script on file. So even if you're in public schools, we have to have the script. You can correct the diagnosis provided by the provider and use the correct one, R63.32. Now, that being said, I have, when I'm doing my billing, I might have F84.0, an autism diagnosis. We might have R63.32, and the child might genuinely also have a dysphagia, because there's emerging pretty solid research out of Harvard on the dual diagnosis, or the increased likelihood for congenital heart defects, especially for VSD, ventricular septal defects, and children that need an entire heart transplant. They're more likely to be diagnosed with autism, like 25 to 30 some percent. And so, but if you have cardiac surgery, you're more likely to have a paralyzed vocal fold as like one of the. So you can have a child that has autism, pediatric feeding disorder, and an oropharyngeal dysphagia because maybe they had an additional ICD, or I'm sorry, ICD-10 code, I had it correct, of a heart condition. So the trick is making sure that you are coding them in the correct order for the ICD-10 codes, and that those codes match what you actually do in therapy, the CPT code.
What
Ethics of billing.
I've
Yeah.
been really stressing to clinicians is that in my mind, and I've had this conversation with other people, is logistically, anybody that you're working on feeding and swallowing with, anybody who you're working on that with should have that R63.32 code, because
Yes.
because you fit in one of those four domains. You're either in the
Yes.
medical domain, the nutritional domain, the feeding skill, which is the skill, the movement, and the sensory piece, or the psychosocial. And so everybody has a diagnosis, and then you can specify more below it if
Yes.
you also have an oral phase dysphagia or whatnot. So, but we
Yes.
went off on a tangent.
Yes. No, but that's something that I see because honestly, like we came through grad school. I know when I was in grad school, I didn't get taught CPT codes or ICD-10 codes. And then you're just tossed out there in the wild. And that's something that embedded within like my coursework, I make sure that I bring to their attention, lest the student not get trained and then they go out and accidentally do fraud because they just weren't taught better. But on that note, Asha makes it very easy. There are tools on the website directly for current ICD-10 codes and corresponding CPT codes. But the super bill, the ASHA super bill for CPT codes, does not provide the amount to be paid because that's set by your state CMS manual. Not they base it off of the federal, but it's each state has their own pay rates. So, which is terrifying because you can go from one state to another state and then find out you're making $10 less on reimbursement, which may or may not have happened to yours truly within the last 2 years. And I was like, wait, what? So, yeah. Okay, so to bring us back to this, which was the original part of the conversation, y'all have been at this for a year and you're now making the companion guide. What insight surprised you the most? Like, what was your takeaway that you were most like, wow, that was meaningful for me? That was a surprise. Like, what was your big aha? Good question.
There was a lot of them.
Mm-hmm.
I think for me personally, it was like Dawn talked about that statistic we have of the number of years of practice of the clinicians who were there, like the people who had 10 plus years. Like these are people who've been doing this for a long time and yet are still like, I recognize the need for change.
Yeah.
Because I think the longer you've been doing something, the longer you can just sort of become like comfortable in your job. And
Yes.
so that to me was like huge of like, wow, like, yeah, if we can really get the speech therapists with longevity in our, on our side, then think of how that can trickle down.
Yes.
Yeah.
Yeah,
Dawn?
I think I loved how people said that their confidence increased, and
Mhm.
just the fact that, okay, this was really scary when I started, and just going through the series, they felt more comfortable, at least, getting started and talking about feeding and swallowing in schools and kind of knowing what to do to get started. So I think that was a big takeaway for me, that I was really pleased with that outcome.
Yeah. Okay. So then the next question to me would be, how do you build on it? Like, what are you doing after the companion guide? Is there plans to make it sustainable so that it's not just like 1 year and then it's out in the world? Like, I feel like, yeah, the knowing nods on your faces. Yes. Okay, Dawn, make me cool. What's the game plan?
Well, Jen, I'm going to let you propose your idea, because we've
Yeah.
talked about maybe if you put it out
We
there, you can manifest it by putting it out
come to
there in the universe.
manifest this, right? So yes, this has been a discussion from day one. Again, because as I said at the beginning of this podcast, I'm very future focused, right? Like,
Yes.
because I have to be looking towards the future. And one of the things we've discussed is how do we keep this sustainable? And so when we started on this project, politically, we were in a different world.
Yes.
And so when we started on this project, my idea was there's got to be money somewhere, and I wanted to become like, or find a fund or a grant or something to say, okay, now hire me as a consultant with the state so that I could go and support different districts, so that I could go and support, different specific schools, whatever, however that looked, knowing that because I do like to make money, I can't volunteer for everything that I do. that is not sustainable. And so that I could be reimbursed for my time, but also know that there was a legal cushion there, right? That I was doing this for the schools. So that was a thought. I also, and actually, Dawn, this is going to be news to you. So surprise! I also just got my I forget how many of these ACE awards I've gotten over the years. I shouldn't blow it off. Like, it is a cool thing, right? But like, I got my ACE award for the year, and I was like, huh. I forgot that you get a discount on insurance. And so then I was like, yeah, and I was like, oh, maybe I should look into getting private insurance again and talk to Dawn again and see if we could talk about that's the problem. I think it's a great question, and it's also realistically a problem that needs to be solved.
Mm-hmm.
Yeah.
Yeah, we have a really cool discretionary grant right now in our state that is supporting speech language pathologists in completing a comprehensive assessment and not over relying on norm reference tests, and just really looking at our criteria for speech language impairment, and how do you utilize other measures. And I could see some iteration of that grant being specifically for feeding and swallowing and doing something similar to what Jen was proposing in where, we would support districts and have someone that could go out to districts, because we have other grants already modeled that are doing that. Whether or not the funding is going to be there is the next big question, but that is our ideal, I think, is to have someone in that type of position that can support districts.
Yeah. Yeah. And but then wearing state leadership hat, I put it back on. That's an opportunity for the Wisconsin Department of Ed to partner with WISHA, which might be the coolest name ever, because Skisha kind of sounds like a scab, and Georgia Gasha, I always thought sounded like a wound, right? But like, I'm not.
My favorite is Flasha.
Well, okay, Flash is fun, but that's just fun.
Yeah.
But yeah, but that being said, those entities typically work close together behind the scenes, right? So making sure that, like, we put in a good word. Hey, can y'all make sure that we cultivate learning opportunities at our state conference this year for, these specific topics, or these are our needs? Because what I found is historically school districts pay for their staff to go, but the catch is that only pulls in the speech pathologist. And as y'all opened with, you partnered with the OTs, with the PTs, and you gotta grow it.
Well, and actually,
Michelle, you just opened. Oh,
sorry. Actually, our statewide OT-PT conference that's coming up this fall, they're having a session. They're having me present a session on feeding and swallowing in schools. So
Perfect.
that is
Yes.
happening. Yes, they are pulling.
Yes.
Yeah. And also, Michelle, you've just opened a can of worms, which I think is an important can of worms to talk about, which is, again, you need to know what's going on at your state level, right?
Yes.
So what you probably aren't aware of is in the state of Wisconsin, we have dual licensure. So legally in the state of Wisconsin, get ready. Okay. Hold down your hands on your couch. Legally in the state of Wisconsin, to work in the schools, you do not need to maintain your CCC.
What?
Right. So how do we find all the speech therapists? How do we get to the speech therapists? They may not even
have to have your C's to bill Medicaid.
You have to have had them at one time, have earned them, and never actually got them, but completed everything to get them. So yes, again, every state is different, but
then how do they maintain current knowledge base if they're that's terrifying,
right? Because we have a lifetime license now for working through the Department of Public Instruction in schools. If you have a lifetime license, there isn't that continuing education requirement, and so that is something that the state association has been attempting to address over the last few years.
20 years we've been trying to work on this.
Yes, but then also, I mean, there are those that won't feel compelled to stay up with continuing evidence-based practice because they don't have to. That's terrifying for so many reasons. And good God Almighty, like that's a lot of work.
So yeah, so I love that you're saying like take it to the state association, but
Yeah.
like there's so many nuances to that here in the state of Wisconsin as far as we don't even know if we know who all the speech pathologists in the state are because of the way that our state works in various levels.
Virginia board, of which I am no longer a part of, did not pulse check membership and made a proposal to get rid of the CF and the need for Cs, of which was not, and this is me expressing frustration, not vetted through nor was membership consulted before any of those policy changes were put forth. And I'm terrified because that is my family members that could be out there being treated. That's my autistic niece. That's my autistic brother in law. Those are my dying grandfather in law who's aspirating with end stage, illness. Like, those are, I want to know that those people do have requirements for current continuing education. And I know Ash is not like perfect. No entity is, and there's room for improvement. But at the same time, it's patient safety for me. Yeah. Oh, okay. Well, Virginia may be a commonwealth, but we don't have dual licensure. So, like, but you guys do have a very cool, it is the try
My best.
try my best.
Try my best. And the year that we had COVID, we did a do-athlon. So we did a do my best. So we still did the outdoor part of it.
Yes. Oh, I love this.
Yeah, get
Ladies,
up and stop.
this y'all's work is so incredibly needed. And I would love to come back in a year and touch base on, like, okay, but what did this look like after this year? Like, what was the feedback from creating the guidance document and after the districts? It'd be neat to pull in one of your district SLPs that they did this for a year and like rehash, like, okay, year one was this was our result, and then year two, this was the result. That would be so incredibly empowering.
Mhm.
So pencil me in
We'll
for,
be here.
okay, sweet. Okay, well then my next favorite part of the show, ta-da, if somebody is so inclined after listening to y'all speak, where could they put a little love money?
So I have two. One is the Try My Best, and we'll have the link there for you.
In the show
Try My
notes,
Best.
guys.
Yeah, co-sponsored between us, Tender Touch Therapy, and our local YMCA here in Kenosha, Wisconsin. You know, we have over, I forget how many athletes, but it's over 100 plus athletes this year that are going to be spaced out and racing their hearts out. It is, I cry, I get shivers. I don't know if you can see, I have goosebumps just talking about it. I cry every year. It's just the most amazing, inspirational day for me. And so I think that that's a great organization because we actually do have people who come from out of state to participate in this because they don't have this everywhere.
Yeah.
And I think the other one, and can I tell the funny story that goes with it?
Yes.
Is that we're talking about offline is I'm also, again, another thing that I volunteer for. This is why we have no free time is I am the faculty, not supervisor. I can't think of the name of it. But anyways, I help with our local chapter of A Moment of Magic. And so Marquette University's Moment of Magic team is a group of college students who volunteer their time. They crowdsource their costumes and they are assigned through a national organization. They are assigned a Disney or Marvel character. And so they do free visits for they come to our triathlon and they do free visits, they do sick kid visits, they do video visits. Right now we have an initiative to focus on kids with pediatric cancer, so we're working with our local MAC fund and our Make-A-Wish fund. But anyway, so the Marquette University Make-A-Wish, or not Make-A-Wish, I'm sorry, Marquette University Moment of Magic. And I have to tell you, so this is my favorite story. You get assigned a character. Like, you don't get to come in and I can't be like, I want to be Cinderella, because they talk to you and they interview you at the national office and then they assign you a character. Personally, I think I'd make a great fairy godmother, but they don't let faculty members do it. I'm disappointed. But anyway, all about the bippity boppity boo. But so these characters, they actually like train you to be your character. And kind of like when you're at any of the theme parks, you have to stay in character. So we had the characters recently at a speech therapy fall event, and there was nobody there yet. It was the start of it, and our princesses are there. And there was this sweet little girl that I know who's neurodivergent, and she was lining up the little ducks in the duck pond, and she's lining them up. And Snow White goes, "Oh, I just love playing with forest animals." And Cinderella comes over and she goes, "I am quite certain that those friends would be great at sewing you a new dress." And Mulan comes over and straight-faced goes, "I'm quite certain that they're lining up to participate in war." And I was like, what is this? Like, this is fabulous. So that's another favorite thing of mine, because they just come and spread joy.
Yes.
That's their whole purpose. They come and spread joy.
We need joy. Yes. Okay,
Yes.
Dawn, who can we support for you, love?
I don't have anything that can top Jen's stories there. I was wondering if your university clinic, like you applied for that research grant, if there's anything that people can support there, or the work Amy Delaney's doing there. Of course, feeding matters. That's
my new
yes.
Right. But so it's called the Marquette University Feeding Clinic, MUFC. Yes, we are always looking for, like, we're just starting. And so not only are we like looking for more funding, right? Because future, but like if you wanted to like donate like some chewy tubes to us, or if you wanted to donate like, some sensory tools to us or something, like any of that, like we would love that, because right now we're using mine. All of mine.
Amy's lab is on Instagram. It's Peds Feeding Lab _Marquette. And it's the Marquette University Neurodevelopmental Feeding and Swallowing Lab. That's the technical one. My favorite was somebody came in one time and they said, "We'd love to donate to the people that take care of your dog's balls." And I was like, I think that has to be edited and rephrased. But it was Bob Barker, like the spay and neuter your pet. And I was like,
yes.
You can't say it like that. But like, it was, it's great. I don't even remember who asked to support the spay and neuter your pet, but it definitely perked me up at the end. That was a day I'd recorded 3 in a row, and that was the third one. And I was like, okay, that was your huzzah at the end of the day.
That's great.
Yes. Okay, so thank y'all. Thank you so much. Are you okay sharing your emails if somebody wants to email you directly?
Sure.
Absolutely.
Okay.
Do you want us to put it in the show notes, or do you want to voice?
If you just say it aloud, that'd be great.
Okay. Well, mine's a little long. So it's Dawn, DAWN .Merth, MERTH -Johnson, JOHNSON, at DPI, Department of Public Instruction, .wi.gov.
Thank you. Jen?
And mine is Jennifer, JENNIFER Eggert, just like an Easter egg, EGGERT at marquette.edu.
Beautiful. All right. Thank y'all for coming on. Folks, catch Erin and I on First Bite Podcast on Instagram, on Facebook. Message us. We promise we'll get back to you. It might take me a minute, but I'm actually digging out of the hole. So, but yeah, we'll be there. Thanks, ladies.
Thanks for having us.